how do you determine whether someone has a genuine penicillin allergy or not?
Traditionally, those patients with penicillin allergies have been referred to an allergist, so a doctor trained in allergy. And those patients would have blood tests for specific immunoglobulin E. They would have skin prick testing for penicillins. And then if they were negative for both of those, then they would be given an oral dose of penicillin. And if the patient didn't react, you would say they've got no evidence, or then they're not going to have an immediate reaction to penicillin. Then they traditionally were sent home with a few days of penicillin, 3 to 5 days. And if there was no reaction at the end of that period, then you could remove their allergy record. You imagine that's quite a labour-intensive process. And if you think of the number of people who are allergic to penicillin, that's a big task. So what's been realised over the last sort of 10 to 15 years is actually in people with a low risk allergy history, you don't need to do the blood test for IgE, and you don't need to do the skin testing because they're always negative in these low risk patients. So what we do is we risk stratify people. And if they're low risk of having a penicillin allergy, we can just go straight to that oral challenge, just go to the sort of gold standard test, which is to give them a dose and rule out allergy that way. So that's how it's being done. And what we're left with is the low risk we can give an oral challenge to straight away, and the higher risk patients, patients with a history of symptoms that sound like anaphylaxis, or symptoms that could be a severe delayed allergic skin reaction, those patients would be managed by an allergist still.
Now, bearing in mind what you've said, I'd like to talk about the PALACE study. What was this about?
The PALACE study is a randomized controlled study that came out of Melbourne. And that was a prospective study looking at the safety of a decision rule that they had developed that enables clinicians to identify patients with a low risk penicillin allergy. So this decision rule is called PenFast. And PenFast is a scoring system that you can use. So you take an allergy history from a patient, and depending on what the patient's allergy history is, you score it. If it's got a score of 0, 1, or 2, that would be deemed a low risk allergy history, and you can go through and delabel that patient with oral challenge and not do skin testing. But what they wanted to do was to test that PenFast decision rule against the current gold standard, which is still skin testing, then oral challenge. So they identified a group of patients prospectively who had a low risk penicillin allergy, so PenFast score of less than 3, and randomized those patients to go straight to oral challenge or to have skin testing first and then oral challenge to see whether the PenFast rule was as good, if you like, as the gold standard. And the answer is yes, it is.
And what are the implications of the findings of the PALACE study?
I think it gives clinicians confidence to use these decision support tools to risk stratify patients. So a lot of the research over the last 10 years or so has used these sorts of tools to identify people who are low risk. And a lot of them have been, several of them have been validated retrospectively in cohorts of people who have been identified as low risk. But by doing a prospective randomized controlled study validation, that gives clinicians more confidence in these tools. So that's what I think the benefit of this has been. We've known that they're safe and effective, but demonstrating that in a robust prospective RCT just gives people more confidence that they are safe and effective.
So could we say it puts numbers on what you're doing in day-to-day practice?
It does. And the beauty of the PenFast thing is it's quick and easy. It's a very simple 3 questions, gives you a score, do something with it. Whereas the other tools, maybe you've got to ask 6 questions and it's a bit more involved, not particularly involved, but the PenFast is quick and easy and it's numbers based. Yeah.